Hello, my name is Laurie Dean. I'm doing this video presentation for Elizabethtown College on chronic kidney disease. First, I would like to discuss what chronic kidney disease is. Chronic kidney disease is damaged kidneys, kidneys that are unable to filter blood normally. And then this leads to excess fluid and waste from the blood to remain in the body. There are other health problems that may result, such as stroke and heart disease. Other health risks associated with chronic kidney disease include anemia, increased risk of infections, high blood pressure, low calcium levels and high potassium levels, loss of appetite, depression, and then as chronic kidney disease gets worse over time, and if it's left untreated, this disease can lead to kidney failure and cardiovascular disease. If it's severe enough, then it could result in dialysis needed for patients or even a kidney transplant that might be needed. Eventually, this would lead to end-stage renal disease. The reason that I chose this specific disease was because I am classified to have chronic kidney disease. The reason for this is because in 2011 I was diagnosed with kidney cancer and I had to have my right kidney removed. After having that removed, I have been working with a nephrologist and I am classified as having stage 3 chronic kidney disease. And as a result of that, one of the complications that I've had has been high blood pressure. I also need to monitor the things that I eat with diet and get exercise regularly. So there are different things that I've had to watch, what I, drink, weight control, and also making sure that I exercise regularly just to make sure that I don't get to one of those further complications that I discussed earlier. The next thing that I'd like to discuss is descriptive epidemiology. And the thing that I focused, or the area that I focused on for this presentation was the person. As you can see, there are different personal characteristics such as gender, age, and race that all play a factor in chronic kidney disease. Really, the highest risk category for age is 65 and older. Women are more predisposed to chronic kidney disease than men. And then the target race for this specific disease would be non-Hispanic blacks, and then non-Hispanic blacks, non-Hispanic whites, and Hispanics also are kind of in that risk category, but the non-Hispanic blacks would be having the highest percentage. Personal characteristics, as I mentioned. In addition to that, there are other behaviors and habits that factor in, such as smoking and obesity. They increase one's risk for chronic kidney disease. There are different descriptive epidemiology items that I really didn't feel applied to this specific disease, such as time and epidemics, things like that, that I really didn't feel like impacted this, so I didn't really factor that in. There's no outbreaks with this disease specifically, such as other things like flu and things like that. And more often than not, people don't realize that they have chronic kidney disease until it's in the advanced stages. Because people don't realize that they have the symptoms and they don't feel ill, it really moves on to the advanced stages until they realize that they have this chronic kidney disease. As a healthcare manager, it's important to think about your community and the people in your community living there. So are you in a community that's more with elderly population, more women, more non-Hispanic blacks? If that's the case, then those would be something that you would need to plan for as a healthcare manager, that you would have to have more of those people possibly coming into your hospitals or organization to be treated for this particular disease, chronic kidney disease. So that would take some decision making, some planning, some organizing, and then you'd want to look at staffing. Also to make sure that you have the right staff there for this specific disease, because it is a very sick population. So it would require specific staffing. You want to make sure that you'd have the right staffing levels to treat this. So as I said, decision making would be a big part of this in conjunction with planning, because you really need to know in your community what type of population that is more prevalent, and that way you'll know what type of people that you're going to be most treating in your type of healthcare organization and be able to plan for that. This is the reference that I've used, or the references that I've used for this presentation. I'd like to thank you very much for your time, and I hope that you've enjoyed it. Thank you.